Skin folds are measured at standardized sites and must be precisely located using anatomical landmarks with the use of this marker. The instrument that's going to be used to measure the skin fold is known as the Lang Skin Fold Caliper. It's important to make sure that the caliper is calibrated correctly with the dial at 0 millimeters as seen in this picture. All measurements will be taken on the right side of the client's body. Each of the 7 skin fold sites were identified and marked before measuring. Before I display as to how to assess the 7 skin fold measurements, the video will be paused for a short segment explaining the skin fold measurement protocol. The procedure to measure all 7 skin fold sites is to firmly grasp the skin fold, hence 2 layers of skin of subcutaneous fat between the thumb and the index finger of your left hand, 1 centimeter above the site to be measured. To grasp the skin fold, place the thumb and index finger about 3 inches apart on the line that is perpendicular to the long axis of the skin fold. Then, pull the skin fold up and away from the body. Hold the calipers in your right hand with the dial facing up. Place the jaws of the calipers perpendicular to the fold 1 centimeter below the fingers and halfway between the crest and the base of the fold, and release all pressure on the scissor grip while keeping the caliper perpendicular to the skin fold. Be sure for each of the 7 skin fold sites, record the skin fold measurement to the nearest 0.5 millimeters and release the scissor grip within 1 to 2 seconds. Now I will proceed with the first demonstration. The first skin fold site is going to be the tricep, which is a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the olecrayon processes, with the arm held freely on the side of the body. The next skin fold site is going to be the subscapular. To make this measurement easier, have the client place their arm behind their back. This will give you a visual demonstration of where the subscapular fold is located. The diagonal fold is going to be 45-degree angle with 1 to 2 centimeters below the inferior angle of the subscapula. The next skin fold site is going to be the mid-axillary. Slightly place the client's arm behind their back to administer the test. This is going to be a vertical fold on the mid-axillary line at the level of the side-fold process of the sternum. The next skin fold site is going to be the chest and pectoral region. This is going to be a diagonal fold. For men, 1/2 of the distance between the anterior axillary line and the nipple, and for women, 1/3 of the distance between the anterior axillary line and the nipple. The next skin fold site is a suprailiac. This is a diagonal fold which is in line with the natural angle of the iliac crest in the anterior axillary line that is immediately superior to the iliac crest. The next skin fold site is going to be the abdominal. This site is going to be a vertical fold 2 centimeters to the right side of the umbilicus. The final skin fold site is the thigh, which is a vertical fold on the anterior middle line of the thigh, which is midway between the proximal border of the patella and the inaugural crease, otherwise known as the hip. Take skin fold measures in a rotational order to allow time for the skin fold to regain its normal thickness, and be sure to retest if measurements are not within 1 to 2 millimeters. The 7-site skin fold equations shows 2 equations for men and women. Both for the 7-site formula are chest, mid-axillary, subscapular, triceps, abdomen, suprailiac, and thigh. Although body density varies between men and women, as you can see the values for each are different. Brozic equation is body fat equals 457 divided by body density minus 414.2. The Suri equation is body fat equals 495 divided by body density minus 450.